Hi, I'm Danielle Matus here at Caring Medical Florida with our patient Joyce. We have treated both of your knees several times, I think 6 times on the right knee and 5 times on your left. That's correct?
Should be pretty good.
Yeah. And so let's get an update. How are your knees doing?
My knees are doing very well.
Love to hear it.
Very well.
Let's talk about the difference between the two, because this right one was actually replaced.
Yes.
Years ago, and we still had to work on it with prolotherapy.
Yes.
Yes. Which actually is not as uncommon as it may sound, because patients, as you are well aware, even after they get a knee replacement, can still have ligaments that are stretched out.
Yes. You do therapy for the muscles, but nobody tells you about the ligaments.
So tell me just a little bit about your story. You had, because your knee was pretty bad before the replacement. It was very much out of alignment and worn down. So you had it replaced, and then tell me what happened after.
After I was it was wobbling. My knee was wobbled when I walked, and uncomfortable, felt unsteady. So I had a friend who recommended prolotherapy.
Okay.
It had worked for her ankles, and so I came in.
Okay.
And got a lot of shots in my knees, but they're not as painful as they sound.
Oh, you're so kind to say that.
And now I'm walking much steadier, much firmer, and doing fine, pain-free.
How far can you walk now?
I did 10,000 steps yesterday.
Wow.
And I probably could have done more, but the dog gave out.
Okay. If you remember, before you started prolotherapy, how far would you be able to walk, or how much in a day?
Barely enough to get the dog to poop and go home.
Okay. All right.
It was, and that was stressful. I couldn't step up a curb or down from curb without feeling like I was going to just pitch over.
And that's scary.
It is scary. It is scary.
And something I want to note is, in cases like this, post joint replacement, the surgeon said the replacement was fine. You absolutely,
fine.
Got that checked.
Knee, go walk.
Yeah, the replacement itself is fine. The replacement is not wobbly, but it's all the soft tissue that's supposed to support your knee. If that is not addressed, you end up like you.
It needs to be addressed. Because even from the surgery, they're kind of bruising up those.
They do. They stretch it out. When they have to get in there. And then your other knee, who did not need a replacement, actually needed less treatments, one less treatment than the knee that was replaced. Just interesting that, with a native knee, sometimes it's a little bit easier.
So, but they're both doing fine, and I'm pain-free.
I love it.
In the knees.
I'm glad to hear it. What we are looking at here, her knee is slightly bent, but these bright white lines, those are her bones. So actually this is her femur, and then that's her tibia. And then right in here is the joint space where the meniscus is. So I'm gonna lift her leg to straighten it. And we're gonna look right there at the space between the bones. And I'm just gonna put a little bit of pressure, actually put a lot of pressure here, trying to stress the joint. And you can see how that space actually stays stable. And so now we're going to look at the replaced knee. So this will actually look a little bit different than a native knee. But if we just lift your leg up, you can still see there the space between the two bones. There's a white line there, that's just the hardware in between the two, but the purpose is still the same. That's the joint space. And here we are. I'm stressing it. I'm actually putting a lot of force on it, and it's barely moving because we have a nice stable knee. Well, thank you, Joyce, for taking the time to let me interview you.
It's been a pleasure.